Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. You create these webinars each week with your questions, and so I hope you ask me some good questions, and I'll try to answer your questions the best I can. Sometimes I do get stumped a little bit, but I'll give it the best try that I can. The way that you create this webinar is with your questions, and again, you write them to me. And where you can do that is over here on the bottom. There's a chat box down there on the bottom of the right-hand side. Go ahead and put your question in that chat box. Now, keep in mind that each time you hit the enter key, it sends a separate question to me, okay? So only hit the enter key one time while you're writing your question. Otherwise, it shows up in multiple parts, and it becomes very hard for me to follow the various parts of your questions and be able to show them to you. During the webinar tonight, I am creating a recording of it. And tomorrow, somewhere around 6 to 6:30 in the morning, you'll get a email notification from me giving you the link to that recording, as well as giving you a link to sign up for the webinar next week. Okay, so yes, we are having another webinar next week, and then that'll be it and through the holidays. And so tonight and a week from now, and then I'm going to take time off for Christmas holiday and also for we may do one the week after New Year's. I have to look at my schedule, to see what that looks like, okay? And so let me see here. Anything else that I want to make you all aware of? I don't think so. I think that kind of takes care of the background piece here. Oh, in terms of the email, it'll come out between 6 and 6:30 a.m. Seattle time, okay? So that's Seattle time, which is 3 hours different than East Coast, okay? So without any further ado, let's go ahead and get started here. All right, so during the webinar, I will go ahead and post your questions on the screen. So I'm going to still read those questions, though, because sometimes in the recorded version, it's hard to be able to make out the questions, all right? All right, so the first question is from Tracy Holliday. Hi, Tracy. I see, do you know the results of RNA? Does it work? What about using it with stevia? Actually, I don't know the product line at all, so I can't say. So I think I'm going to get stumped on that first one. And I also see that you've written a second question to me, too. Let me go ahead and post that one. And I think I'm going to get stumped on that, too. Now, it's rare that I get stumped out of the block twice, okay? So hang in there. For those of you that are new, I will have some good answers for you eventually, I hope. All right, this is from Tracy again. What, in your opinion, is the best PEMF for Lyme? So PEMF, everyone, is an electromagnetic frequency device that you lay on. And frankly, I don't know. I do make certain recommendations or have an idea what are good Rife machines, which is another way of doing electromagnetic frequency machines. However, I cannot state those here online because the FDA says that physicians cannot recommend these devices, and so I can't tell you. But I actually do not know of a good PEMF device. I'm not sure which one is a good one that is out there. And even if I did, I couldn't recommend it because of FDA restrictions on what physicians are able to talk about. All right, that's my response there. Thanks for that question, Tracy. Sorry, I got stumped by you 2 times tonight. All right, let's see here. Hello, Kobe. Let's see. Even when I'm not treating, I feel good after about 8 weeks. I feel about to turn the corner, but then flare symptoms and repeat. It is very relapsing, and it mainly affects memory, cognition. Slow developing, had this about 6 to 7 years. What is it? So there are some people with Lyme infection that will have a cycling of their symptoms. And a common frequency is actually every 4 weeks, where we'll see symptoms get worse. We think it has something to do with the growth cycle of the Lyme germ. We think that Lyme grows more aggressively about every 4 weeks. And so for some people, it is on a 4-week cycle that they get worse. Now, your 8 weeks is a multiple of 4 weeks. And so maybe in you, that is how it's showing up. Instead of 4-week cycle, it is an 8-week cycle. So again, we think it has something to do with the growth cycle of the germ. And I think it's more commonly seen as part of a Lyme a germ, not necessarily of the co-infections. So you asked if this sounds like Babesia or some type of Borrelia. I mean, that's the second part to your question that I'm posting here. I would not think of this as being part of Babesia. I wouldn't think of this as being part of a co-infection, but I would think of it as being part of the way that Lyme is probably showing up in you, okay? And in fact, when I'm taking histories on people trying to figure out what do they have, what is this condition that they have, what germs might be active, is it Lyme, is it not Lyme, I'm often going to ask, as part of my history, is there a cycling nature to it? And so again, the cycling nature, especially with Lyme, of a 4-week or maybe even a longer frequency, can be suggestive of being a Lyme infection. Okay, all right. Thank you for that question, Kobe. And good luck to you. Let's see. Hello, Thomas. Are we started yet? Yep, we just started. So just so you know, when you all are in this waiting room waiting for me to show up, I actually don't start the webinars until about 5 or 5:01. But you can get into this room before I start, and that gives you a chance to post your questions, basically, okay? That everyone back there that you just saw hopping around is one of my dogs. There actually are 2 of them here tonight. Those are my Basenjis. You may see them move periodically, okay? They come to work with me, and this gets into their walk time, so they sometimes get a little restless, especially at the beginning of the webinars. That's Halo back there. Sometimes you may see her brother called Thor that shows up as well, too. All right, let's see here. Hello, Casey. Let's see. Hi, I recently asked you a very lengthy question several weeks ago regarding me having stomach problems, gas and bloating, no pain. For the past 3 months, I figured it was yeast, but I was wrong. It turned out to be my gallbladder. How common is it for Lyme? Let me go to the second part of your question there, Casey. Lyme patients have gallbladder issues. Mine is functioning at 16%. Is there anything I can do to improve this and avoid surgery? Or am I just going to run into more problems in the future? Is this caused by antibiotic treatment or completely unrelated? Thanks for all you do. All right, so, Casey, I don't know what your age is, but it is not uncommon that as we get older, men and females can develop gallbladder illness. So it could be something totally separate from Lyme disease, okay? Having said that, we know that Lyme can infect the gallbladder. So therefore, sometimes people with Lyme have gallbladder symptoms that develop. Now, there's no way for me to know whether your gallbladder symptoms are coming from Lyme causing it, or is this just something that might have manifested. But yes, Lyme can infect the gallbladder and give gallbladder issues, okay? Now, there's one other thing that can happen, and that is one of the antibiotics that we use in Lyme sometimes can bring on gallbladder disease too, and that is the IV antibiotic ceftriaxone. Can sometimes lead to gallstones forming, okay? Because what ceftriaxone does, which we use for IV antibiotics, ceftriaxone causes the bile fluid, the liquid that's in the gallbladder that comes out of the liver, it causes it to get thickened and sticky, and that can lead to easier formation of gallstones, okay? So often when we have people on ceftriaxone, we'll also put them on a medication to thin out the bile. So you have to look back and see, were you on IV ceftriaxone before? And if you were you on a gallbladder or a bile fluid thinner? That's a medicine called ursodiol. I often will put, if I have people on IV antibiotics with ceftriaxone, just the ceftriaxone, then I will have them on the ursodiol to thin out the bile so that we tend not to get those gallstones forming, okay? Now, if you have gallstones, that's giving you a problem, because I can't tell from what you wrote here as to whether they were actually seeing gallstones or not. If you have gallstones, you could use the ursodiol to actually help break those up. If it's a type of stone that has a lot of cholesterol in it, ursodiol can work very well to help break up those kind of gallstones, and sometimes you can use that over the course of a year. If there's gallstones in there too, sometimes they can do lithotripsy, where they actually break it up with sound waves. That's a possibility too. But this is something you probably ought to be talking with your gastroenterologist about to see what ideas that they have for you in terms of treating it. Can it be treated or not? Okay. All right. I hope that answers your question. I'm sorry to hear about that too. One last thing too, Casey. It's not often when people have gallbladder disease, you will have pain. So that's kind of odd that you did not, but it's not. It doesn't mean you don't have it. Okay. So, but usually, often people will have some degree of abdominal pain with it too, and that's why probably when you brought it up, I don't fully remember you bringing the question up last week or whenever you brought it up, but I wouldn't have thought of gallbladder disease necessarily because you didn't have a lot of pain back then. That gassiness and bloating often in Lyme disease usually means you get too many yeast living in the intestines as well too. Okay. All right. So good luck to you. Hello, Margaret C. Are any of the common herbal remedies known to be carcinogenic? None of the ones that I recommend are, except L-theanine, which is an amino acid-like chemical that is a component of green tea. L-theanine at high doses can be carcinogenic. If you notice in some of my information, if you read about what I've written about L-theanine, as I use it for sleep or pain control, I tell people not to have more than 1,200 milligrams a day. And that's because doses above that, there is some evidence that it can be carcinogenic, but not at the doses that I use it. I am not aware of any of the other herbs that I recommend, and that's all I can speak about is the ones I recommend in the Treat Lyme book or in these webinars, which often are a manifestation of what I write about in the Treat Lyme book. I'm not aware of any of them being carcinogenic. Okay. All right. Now, for prescription antibiotics, two of the common ones that we can use in Lyme, something called metronidazole, which is flagyl, and a brother or sister of it called tinidazole, Tindamax. Those in rats can have some carcinogenic potential. We don't think they necessarily do at the doses we use in Lyme, but to be thorough, those two antibiotics sometimes can. Okay, all right, but in rat populations, not at the doses we use in humans. Okay, all right. Thanks for that question, Margaret. Good luck to you. Hello, Jackie. Hold on here just a minute. Bear with me a minute, everyone. Just set up a new camera and microphone here, and I wanted to make sure that you all are hearing me, and I don't see anyone that has posted saying they can't hear or see me. So supposedly this is supposed to be a more powerful camera. I hope it's giving a little bit of a better image. And I hope my sound system's still working okay for you too. All right, let's see. Hi, Jackie. Let's see. I have been taking antibiotics for almost a year, and I'm about 85% better. Good. I'm glad to hear that. I recently started Tindamax and have stabbing nerve pain with it. What other antibiotics can cyst bust? I don't trust grapefruit seed extract. Does enough? Should I stay on antibiotics until all symptoms are gone? Okay. So the Tindamax and flagyl, they're both part of a family of antibiotics called the azoles. And I use them interchangeably, although I tend to like Tindamax better than the flagyl as a cyst buster because it tends not to have the side effect problems that metronidazole does. And according to some Petri dish experiments, the Tindamax is also a good biofilm buster and is a little bit better than what flagyl is as a biofilm buster too. For those of you that don't know it, Lyme has the ability to grow a slime layer that covers itself. And in that slime layer, that's called a biofilm. There's a bunch of other bacteria that live there. And they set up a system to block out the immune system and to make it harder for antibiotics to work, okay? And Tindamax tinidazole happens to have some ability to break down those biofilms. There's better biofilm breakers. And in fact, I just posted an update of my biofilm article earlier this morning, which introduces a newer product that I'm starting to use called Biocidin to break up biofilms. I'm also using that product called Biocidin because it's great at treating Lyme. It actually changes one of the defense mechanisms that Lyme uses to kick antibiotics out. Lyme can actually pump antibiotics out of the inside, and it appears biocidin can help block some of that. Biocidin breaks down biofilms. Biocidin treats bacteria of SIBO. Biocidin treats yeast. I mean, it's a good all-around antimicrobial, and I'll probably get a chance to talk to you more about it tonight if we get a chance. But I also have an article up about biocidin too. So there are 2 new articles in the Treat Lyme book. If for those of you that haven't been there lately, I haven't been that good this last year about writing due to a divorce I went through. And also my medical board decided they don't like me treating Lyme, so I had to do some defense of my practice, and that happened to take quite a bit of time. But I'm back writing again, and I'm glad to be doing that. And the medical board is letting me practice, so that's where we are at this point. Okay, so but you'll start seeing more new articles come out. So stay tuned to the Treat Lyme book. But the 2 newest ones are an update to the Biofilm article, and then introducing this new herb that I'm putting in my practice because I think it looks pretty impressive, called Biocidin. And again, you can find the article about that herbal complex at the Treat Lyme book. Okay, so having said that, let me get back to this. And so again, the relationship with Tindamax sometimes can be a good biofilm breaker. Okay, all right. So the problem with Tindamax and the problem with metronidazole is that both of those antibiotics can interfere with B6 metabolism in your nerves, and that can lead to neuropathy in some people. All right. And why I'm thinking neuropathy is stabbing nerve pain is neuropathy. It means nerve injury. So one thing you could do to see if you could tolerate the Tindamax is to add vitamin B6. And what you would do is use a 50 milligram or 100 milligram pill, and you would want to do that 2 times a day. All right. B6 can help with neuropathy that occurs in Lyme. Okay. All right. Other cyst busters that you might want to consider. I actually like grapefruit seed extract. I think it does a great job. I think it is nearly as potent as Tindamax and as metronidazole, and does not have the huge side effects. Other herbs that can break up cyst, apparently the Biocidin that I was just telling you about can. The Banderol Cemento, which are 2 of my favorite herbs for treating Lyme, also do a great job based on Petri dish experiments and breaking up biofilms and breaking up the cyst form of Lyme. Those are an option for you to consider. Those are sold. The generic on those is a cat's claw and otoba bark extract, better known as Banderol Cemento. Okay. Other prescriptions that you could use is rifampin. Rifampin is an anti-tuberculosis medicine, but has some anti-cyst properties. Also is good at treating the cyst form of the Lyme germ too. Okay. And if you want to look for more information about other ideas about treating cyst, about how to use these, take a look in my article about Lyme disease antibiotics. All right. Let me just show you where you'd find that here. So I'm going to do a quick screen share here, everyone. Well, what's going on here? Nope, that's not working. Well, I'm not sure if my screen share thing. All right, there we are, back again. All right, Jackie, good luck to you. Thank you for that question. Hello, B. Let's see. Is there anything that can be said to someone who believes the IDSA guidelines and won't get tested? A history of Bell's palsy, irritable bowel syndrome, and spinal pain requiring steroids. What test is best, and is there better late-stage detection with ELISA, Western blot? Thanks, Dr. Marty, for everything. B, I don't know how to convince people that are not willing to look beyond the IDSA guidelines. I mean, that's their problem. I don't know what to advise you other than to say that the one thing you might want to show them, actually one thing you could take a look at, there's an article that came out, a fairly easy to read article. It's was written for physicians, but is very understandable even for non-physicians. It's an article written by a physician named Ralph Stricker, who used to be head of ILADS. It was written 10 years ago as an opposition piece to the Infectious Disease Society of America when they first came out with their guidelines denying the existence of chronic Lyme. And it went through their guidelines and basically was a counterpoint. It basically showed all the science they ignored and why they were wrong. And I think it does a good job. It's a 10-year-old piece, but it still is very relevant and current enough, okay? And so you Google Stricker, Stricker, and the article is called Counterpoint. Just do those words, Stricker and Counterpoint Lyme disease, and you'll find that article. I forget the full name of it, but that is a good piece that you could show another person to read to say, please consider it. Here's another side to the story. Okay. All right. All right. In terms of their symptoms, yeah, Bell's palsy is something that can be part of a presentation for Lyme disease. Keep in mind that herpes zoster and herpes virus also can give Bell's palsy. So not all Bell's palsy is necessarily caused by Lyme, okay? So anyhow, just keep that in mind, okay? So let's see, what is the best test for late-stage Lyme, okay? So there's an article I have about Lyme disease testing, which is mostly current, but and I'll be updating probably within the next month about that. I've got it as about the third or fourth article that I need to update here. But so in that article, I described the various types of Lyme testing, okay? So it talks about ELISA testing, it talks about Western blot testing. And when I wrote that article about 2 years ago, the best test we had was the Western blot. Okay. Now, what's happened is IGeneX recently has come out with a new test called a SIRAspot, which is a derivative of a Western blot. It's not identically a Western blot. And the SIRAspot actually looks to see if you have antibodies against various European strains of Lyme disease versus the Western blot is looking to see is your immune system making antibodies against one or two strains of American Lyme disease, okay? So the SIRAspot is probably going to do a better job of picking up Lyme no matter where you caught it from. And the SIRAspot, from what I have seen from IGeneX, has a 90% sensitivity, meaning it can find Lyme if you have it about 90% of the time. Their Western blot through IGeneX has a sensitivity to find Lyme of about 80 to 85%. So their new SIRAspot test, it looks like it's going to be a better test based on some limited research that they've done, okay? All right, so the SIRAspot and Western blot. SIRAspot is kind of like a Western blot. It's just not quite identical. Without getting into the details of the big differences, just know the SIRAspot is maybe 5 or 10% better at finding the Lyme germ than a Western blot. Okay. The ELISA test that you mentioned here is actually a very horrible screening test and will only find Lyme if you have it about 60 to 65% of the time. I'm sorry, 50% of the time, excuse me. And the Western blot done by this using the CDC approved method and an FDA approved test kit, that's what like LabCorp would do, Quest Diagnostics would do. That method of a Western blot will only find Lyme if you have it 60 to 65% of the time, okay? All right, so what does a Western blot do? It looks to see if you've made antibodies. What an ELISA does is it looks also to say, it asks the question, do you have any antibodies in you that could be made against Lyme? The Western blot and the SIRAspot go one step further, and they say, do you have Lyme antibodies in you that actually attach to proteins found on the covering of the Lyme germ? All right. The CDC recommends that you use the FDA approved test kit and that you do a two-step process of doing the ELISA first and then follow that with the Western blot only if the ELISA is positive. But that's a ridiculous testing method because the ELISA will only find Lyme if you have it about 50% of the time. The reason that IGeneX gets a better chance of finding Lyme either with their Sera spot or with the Western blot is they're looking to see if you have antibodies against more proteins on the Lyme germ than what the CDC FDA approved test kit does, okay? Also, on the Western blot, they're growing 2 strains of Lyme germ and killing them to take their proteins away versus the CDC FDA approved test kit is only growing 1 strain of Lyme, which is the original strain discovered back in the 70s, okay? So that's a very old, antiquated test. The Sera spot that I'm talking about uses, I think, about 4 or 5 different strains of Lyme, including some of the European strains, and so probably is a better test even than the Western blot, all right? All right, now, IGeneX also recently has come out with a test called an ELISpot. And what an ELISpot is a method to see are your T white blood cells that are T cells are the kind of white blood cells that attack germs, okay? And in an ELISpot, what we do is we take those T cells and we expose them to Lyme proteins and we see if they release certain cytokines. If they release cytokines when exposed to those Lyme proteins, that means that they know Lyme. They have seen Lyme before, okay? So it's a way of measuring, has your T cells actually reacted, okay? Now, I haven't seen the actual data on the testing method for IGeneX, but generally ELISpot tests are at about 90 to 95% sensitivity too. So that is a new way. And when I write the new article coming up, I'm going to be talking to IGeneX to get their information about their sensitivity with their ELISpot method, okay? But what I would suggest to your friend or whoever wants to do Lyme testing, don't do a 2-step test using one of the FDA CDC approved kits. You could do still the old style Western blot through IGeneX. That works about 85% of the time. Or a better way probably is going to be do the new Sera spot, which will find about 90% of the time. And I think their ELISA test is probably 90 to 95% of the time, but I have to still check to be sure about that because testing generally about the ELISpot test does show it can be around 90 to 95%. I have to check and see that what they found out about their specific test at IGeneX. Okay, all right. So I hope that gives you some information then. And thank you for that question. Oh, let me do a quick screen share again here. All right, so needed to include the new information about the IGeneX ELISpot test, nor the new Sera spot test that they have, but other than those, it does give you a good review of all of the ways that we can test for Lyme, including blood cultures, including PCR testing, including Western blot, including ELISA. And so what you would want to do is take a look at my article on Lyme disease testing. It's in the test chapter, and it's called A Review of Lyme Infection Test, Pass or Fail, okay? And again, I'll be doing an update based on the Sera spot and the new ELISpot test that IGeneX has just introduced. You'll probably see that within the next month. That article will be coming out. All right, let me go back here. And good luck to you. Hello, CJ. Hi, Dr. Russ. Thank you for all you do. You're welcome. Can a person over-methylate? What would that look like? What is worse, over or under methylation? Good question. To be honest, I don't know. I don't think you can over-methylate, but I've actually never studied that question before, so I don't know for sure. So I'm not going to be able to comment on your question. You've stumped me. congratulations. But it's something I'll have to look into. I'm not sure whether you can actually over-methylate. Okay. All right. Thank you for the question, CJ. Hello, Andrew. Let's see. How common are neurologic symptoms with Lyme disease? They're quite common. The most common neurologic symptom that most people with Lyme will have is some degree of cognitive impairment, meaning thinking impairment. Okay, so that's neurologic. Okay, that's probably the most common thing that people have. They either have difficulty with short-term memory, not long-term memory, but usually short-term memory, or they may have difficulty processing information and learning new things. They may also have difficulty focusing on things as well too. Okay, so those are the most common neurologic things. Other neurologic situations that people get is they may get numbness or tingling or burning sensations from nerve injury. They could get part paralysis where they can't use a finger or an arm or a leg. Sometimes neurologic manifestations could be tremors or seizure-like disorder. Those are things that people can see as well too. All right. So there's a range of things that can happen, but the most common effect of neuro-Lyme would be difficulty with thinking. Okay. All right. Thanks for that question, Andrew. Hello, Barbara. Let's see. Hi, Dr. Ross. My daughter has BABS, SIBO, high Epstein-Barr virus, Lyme, BART, fatigue, bad headache, stopped antibiotics, was on Xifaxan 4 times for SIBO with no help. Not sure what to do next. Can you help? Yes, I can. All right. So SIBO, everyone, stands for small intestine bowel overgrowth. All right. And it basically is caused by bacteria that should not be in the small intestines getting there, usually coming back through this large intestines, the valve. There's a valve where the small intestines meet the large intestines. There's a valve called the ileocecal valve that is supposed to keep bacteria from coming back up from the large intestines. And sometimes that it doesn't work quite right. You get bacteria from your small or your large intestine moving back up into the large intestine, the small intestine. And common symptoms of that can be a lot of belching, burping, sometimes nausea. It sometimes can be difficult to distinguish from yeast overgrowth, which can sometimes give you similar symptoms. The way you determine ultimately if you have SIBO is to do a breath test. And there are certain labs that you can do that through. You blow into tubes after you've had a source of sugar over about 2 hours, and they're measuring methane and hydrogen. And depending on what those levels are, you can determine whether you might have SIBO or not have SIBO, okay? The most common way to treat SIBO is with Xifaxan, and also known as rifaximin. Sometimes it can take 2, 3, or 4 times to get rid of it, but Xifaxan doesn't work all the time. And so sometimes we have to use other things. So for instance, you can use neomycin, you can use oregano, for instance, too, okay? Now, what I'm starting to use actually is this new, or an herb that I'm introducing into my practice and have been for about the last few weeks, an herbal medicine, which is called Biofilm, okay? And I have a whole article about it, and I think it's a very impressive herb that I'm going to be using for a variety of reasons. So Biofilm is an herb that has a number of components to it. So it's got some immune boosters in it, like shiitake mushrooms. It's got some echinacea in it as well too. It's got various oils in it, like oregano oil, lavender oil. I'm trying to look at my product description here of it. It's got a golden seal in it. It's got some raspberry in it, but it's got a number of components that are useful in a lot of ways. Okay, so first of all, there's some very compelling petri dish experiments that show that it removes biofilms. So as many of you know, biofilms block Lyme treatment, but biofilms can block yeast treatments. Biofilms can block SIBO treatments, okay? And these components within Biofilm look like they can remove biofilms on a variety of germs, according to, I guess, 2 separate. One petri dish experiment looking at various bacteria another set of Petri dish experiments looking at Lyme and Lyme biofilms, and the Biocidin does a great job of removing biofilms for those situations, okay? The second thing that I find interesting about Biocidin, and I'm going to come to your SIBO here in a minute, the second thing that I find interesting is that Biocidin has the ability to block an antibiotic-resistant method that germs use, especially when they're in biofilms. And that is, germs can use a pumping mechanism called efflux pumps to pump antibiotics out. So basically throwing the stuff out that we're trying to get in them to kill them, they have the ability to pump it out, okay? And there's a number of components within Biocidin that have the ability to block those pumps, making it so that Biocidin, the components of it, can concentrate more strongly within these, but any antibiotic actually that gets inside of cells will concentrate more strongly because those efflux pumps are blocked, okay? And the Petri dish experiments actually do show, or these modified Petri dish experiments do show, that that being on Biocidin leads to greater concentrations of antimicrobials inside of germs, okay? And then finally, Biocidin, because of the various oils that are in it, including tea tree oil and rosemary oil, is an effective germ killer, and it appears to kill all three forms of the Lyme germ, gets rid of most of their biofilm, okay? And in addition, can kill yeast, and in addition, can kill the germs that are involved in SIBO, okay? So it's a good broad spectrum antibiotic and can be used in a number of ways, removes biofilms, and also can limit germ resistance, okay? All right, so how would I use it for SIBO? Well, what I would do, and the reason I would think about using it is you could, not only will it help with SIBO, but it gets your daughter back on a treatment for her Lyme infection while you're trying to get rid of the SIBO as well too, okay? And so the Biocidin comes in about three main forms, okay? There's pills, there's liquid drops, and then there is a liposomal variety, okay? Liposomal means it's microscopically wrapped in fat. And the benefit of the liposomal variety is that because it's fat-based, it likely is to cross over into your brain better. Things that cross over the brain, there's something called a blood-brain barrier that keeps things out of the brain. Things that are microscopically wrapped in fat have a better chance of getting in, okay? So if you have Lyme, it's going to do a better job of getting in, okay? Secondly, being liposomal, it can get inside of cells easier too to help treat intracellular Lyme, for instance, too, okay? If you were not wanting to treat Lyme, instead of using the liposomal variety, though, you could use the pill form of Biocidin, or you could use the liquid drop form of Biocidin. But I would suggest doing the liposomal variety, which can help with the SIBO in your daughter's situation, and could also help with Lyme and all those other things that I was just talking about, okay? And so what I would suggest you do, depending on which form you decide to use, there's different directions. I'm not going to take time to go through all the directions right now. I will show you the article so you can take a look at it. But I would consider getting on that as a means of treating her SIBO and also as a means of treating her Lyme while you're waiting to get the SIBO under control, okay? All right, then the other thing I would do with SIBO, you don't want to use regular probiotics. Regular probiotics can make SIBO worse. What can be helpful, though, is spore-forming probiotics. These spores are actually kind of like an egg form, if you will, of a probiotic. So it's not fully living, it's not alive and active, but when they get into an environment that is not hostile to them, they will grow into regular probiotics and repopulate to fight away germs that shouldn't be there, okay? And so a good spore-forming probiotic is also made by the same company that makes the Biocidin. It's a product called ProFlora 4R, and I would do one pill probably twice a day is what I would do. And you want to take that, make sure you're taking it away from your antibiotics, okay? Don't take it directly at the same time as the antibiotics, all right? So that's ProFlora 4R is what I would wind up doing for that, all right? So let me show you the article about the Biocidin here. And again, I'm using it now in my Lyme disease treatments too. I'm using it as a biofilm buster. I'm using it because it can treat Lyme as a standalone product. I'm just really impressed with what I'm seeing with this. So let me do a quick screen share here. One thing you can do, if you just start reading some of the articles over here, you can see my latest updates. Here's the one on Biocidin. Here's the one on biofilms that I told you about this morning. But another way that you could find this article about Biocidin is look under anti-germs. Okay, that's where I've tucked it away. And this is the article. Within this article, I do describe how it works. And towards the bottom, I give you the dosing recommendations for it as well too, okay? So you can find that in the Treat Lyme book. I even review the science behind it as well too, okay? And there's references here as well on this, all right? All right, then the other thing I'll just show you quickly, this is my store, Marty Ross MD Supplements. This is any supplements, whether I talk generically or brand names that I recommend, you can find here. The reason I carry supplements is these are for my patients. I have them get them here because I want to make sure they're using good quality products. And with supplements, there's certain brands that have done a better job of assuring that they use the best active ingredients. And I've gone ahead and I've scoured the various supplements out there to try to find the brands that are going to have the best chance of helping you. Also, ones that tend not to use a lot of artificial fillers that could hurt you, okay? So you can find the Biocidin under this tab called Biobotanical Research. And there are 3 different forms of it. There's the capsules, the liquid, and the liposomal variety called LSF here, okay? And then the other thing, their Pro Flora that I was telling you about is this product here, their Pro Flora 4R, okay? All right, let me go back here again. All right, Barbara. Thank you for that question. Good luck with your daughter. Okay. You know, I don't think Biocidin, I wouldn't necessarily look at it as something for Babesia. I do want to let you know about that. And I don't think I necessarily would consider it for Bart, but maybe I could if looking at the broad ways that it can work. Okay. So anyhow, I hope that gives you some insight. Good luck to you. Good luck to your daughter too. Oh, and using it for SIBO, you're probably going to want to treat for about 3 months with it. But at least while you're doing that, you're back into a Lyme germ treatment too, okay? Meaning that it's a Lyme germ treatment as well. Okay. Good luck to you. Hello, Kobe. Let's see. Hi. Thank you. Try to sneak a second question in where you're getting away with it this one time. Have you found dapsone, pyrazinamide, and diethylcarbamazine helpful in dealing with Lyme and co-infections and parasites? So I haven't used the third one you mentioned there, the diethylcarbamazine. I have used dapsone and I have used pyrazinamide in a limited degree. So pyrazinamide might be useful against Bartonella. I still think there's better agents like rifampin and rifabutin and other ones that I use. I've written about those before in the Treat Lyme book. You can take a look at that article, okay? The dapsone, you're going to probably see an article coming out in about the next week about dapsone. And so I am using it. I'm using it because it's helpful for something called Persister Lyme, Persister cells. And I'm using it based upon the research of Richard Horowitz, Dr. Richard Horowitz. I think many of you are aware of that research. And what dapsone is, it's a medicine that historically has been used in the world of leprosy. And leprosy is known to have something called persister cells. We have wondered for years whether Lyme has the ability to develop persister cells. And we now have research that came out a couple of years ago that was a laboratory experiment done out of Northeastern University in Boston that showed that, in fact, Lyme can develop persister cells. And what those and in that experiment, or what a persister cell is basically when Lyme is exposed to antibiotics repeatedly, some of the spirochetes and some of the cyst will turn into a persister state. Okay, so it's a form of a cyst and a form of a spirochete. And what happens is a persister is they slow their metabolism way down. they effectively go into hibernation and they ignore the antibiotics, okay? All right, and what the Northeastern University Petri dish experiments showed us is that it happens about to 20% of the spirochetes and about 20% of the cyst. I don't know what happens in a living person. No one's done those experiments, okay? Now, regarding persisters, there has been some people interested in looking at what to do about it, okay? So that Northeastern experiment, for instance, looked at the idea that if we started and stopped antibiotics, if we pulsed them, could people get better? Or could actually, these were Petri dish experiments, would the Lyme go away on a Petri dish, okay? And what they were able to show in those experiments is that if you started and stopped antibiotics and you used them and then stopped for about 24 hours, those persisters would come back alive again or come back to get growing and being more active again. And if you did that, you started and stopped 4 times, you could wipe out all the persisters, okay? That's what they showed in that experiment. Now, because of that, a lot of my colleagues started doing pulse regimens, and I'll do them sometimes too. And pulsing, like a 4-day on, 3-day off, may be one way to get at persisters. I don't find it universally works though, all right? But I know that based on the experiment, it could help. What I find is maybe a handful of people, a small percentage of people get help by doing that kind of pulsing, 4 days on, 3 days off of your antibiotics, okay? Now, what's interesting is there's a researcher out of Hopkins University, Dr. Zhang, who has taken his tuberculosis lab, which tuberculosis is a germ that forms persisters, and he's starting to refocus the activity of that lab, and they're doing a lot of research about methods to treat Persister Lyme. And what they're showing in their lab is that pulsing is not the right way to go on Petri dish experiments, that you want to use the antibiotics continuously. All right, so we got competing Petri dish experiment research, okay? Now what Dr. Zhang has shown is that in his lab, using the antibiotic Bactrim can be helpful against persisters. And the one regimen that he has looked at doing Petri dish experiments that I've been using in my practice is to use a combination of cefuroxime coupled with Bactrim, which is a sulfa antibiotic, coupled with doxycycline. That's what he's researched. I also throw grapefruit seed extract into my practice because I still think we need to do something about the cyst limes, okay? Or the cyst form of Lyme. Now, on Petri dishes, he's gotten good results with that, okay? Of those 3 drugs, cefuroxime, doxy, Bactrim, okay? I've tried using that combination in my practice. I get mixed results. I find maybe about 50% of people get some help with that, okay? But that is a regimen that I will use, a cefuroxime, which I do is 500 milligrams twice a day, or I might do 2 of those 500 milligram pills twice a day, coupled with doxycycline, 100 milligrams twice a day, or I may go up to 2 of those twice a day, coupled with Bactrim DS, which is the adult strength Bactrim, 1 pill twice a day, and then grapefruit seed extract, 250 milligrams twice a day. I use that as a continuous regimen. I don't pulse it, okay? All right. Then the third way that I'm looking at dealing with persister cells is the dapsone regimen. And so dapsone, what happened is Dr. Horowitz, looked at the world of leprosy, and he saw that in the world of leprosy, if we use dapsone, or that they were using dapsone to treat persister cells, and he wondered, I wonder if this will work for Lyme. So about a year ago, he published, I think it was November last year, he published the findings of research that he did on 100 people in his practice, and he found benefit in a large number of those people. And those were people that basically it had been blocked in their treatment. They were having a hard time getting better. And a number of those people also had babesia. And in fact, the people in that study that had the best outcomes were people that had babesia, because dapsone also can treat babesia too, okay? Now, he's subsequently has done some further follow-up. He's enrolled, I think, another 100 people in that study, and he's still following what happens with them. But what his research is showing is that probably dapsone can work well with a lot of people, but 30% of people have to stop it because they can't tolerate it, okay? Or they develop bad side effects. And that's what I'm seeing in my practice as well, too. It's a hard drug to use. And when I use it with people, I advise them, this is going to be a hard drug. We'll have to see if it's going to work for you. But when it does work, and I find about maybe 60, 70% of people are getting benefit out of using it in my practice, it can create some pretty good improvements. So for instance, I've got a patient of mine that had been on IV antibiotics prior to seeing me for, I think, maybe a year or two or a couple of years. And we continued that for another year. Then we went to doing, I think, a 2-month on, 2-month off regimen for a while. Anyhow, she was a nurse that really could not go back to work. And after about, I think, 6 months of using dapsone now, she's going back to work. Okay? I mean, it's had significant results for her. Okay. And so the way that I start dapsone is I'll start it at, I've learned to start low and slow with it. You want to start at 25 milligrams every other day. And after a week, if you're tolerating it, it hasn't caused you to have significant side effects or a bad Herx reaction, then you go up to 25 milligrams daily. After another week, you go up to 50 milligrams, alternating with 25 milligrams every other day. And then after another week, you go up to 50 milligrams daily. All right. And that's where I have people stop initially. If I can, I try to get them all the way up to 100 milligrams, which is the top dose, but I find that gets to be a little bit hard. Okay. So the problems with dapsone are it has a side effect profile, side effect problem list that looks like a Herxheimer reaction. Okay. It can give you myalgia. It can give you fatigue. It gives you symptoms that look like a Herx. Secondly, you can get some pretty severe Herxheimers on it as well, too. So that's why you got to go low and slow. All right. But the biggest problem is it can lead to really severe anemia. And that's because it interferes with folate metabolism. So when somebody is on dapsone, you've got to also be taking folate. And I like using a methylated version. And I start somewhere around 15 milligrams. And I may build them all the way up to 60 milligrams based on repeat blood count testing, okay? But even with all that folate, sometimes people get such severe anemia that you got to pull them off the medicine, okay? You just have to stop it because of the degree of anemia, all right? In addition, to get through the Herxes that it can cause, I put everyone on glutathione. And I like using the trifortified liposomal glutathione that I've talked about in these webinars before. It's made by Research Nutritionals. I'll do 1 teaspoon 1 time a day. But if they're really getting bad Herxes, I'll go up to 1 teaspoon twice a day, okay? Now, you couple your dapsone with other antibiotics. And what I find it to work best with is rifampin and doxycycline. Those tend to be the two that I like to combine it with. But if a person can't tolerate those, I'm going to use other intracellular antibiotics to combine it with as well, too. Okay. So am I using it? Yes. I think Horowitz studies would suggest there's 30% of people can't tolerate it. I'm finding a similar result. I'm finding about 60%, 70% people getting benefit out of it. I'm also again for Persister Lyme looking at one of those Dr. Zhang protocols from the Petri dish. And I find that combination of cefuroxime, doxycycline, Bactrim coupled with grapefruit seed extract to work maybe about 50% of the time. And I am becoming less inclined to do pulsed regimens because I just don't find them to work that well. Okay? All right. So that's my whole explanation of what to do about persister cells. And I guess I'll probably be able to take this video clip and turn it into a new article, because on my agenda for one of the articles I want to write in the next couple of weeks is an article about approaches to Persister Lyme. So I guess I just explained it there for you all. All right. Thanks for that question, Kobe. Good luck to you. Hello, Ginger. Dear Dr. Marty, do you think intracranial hypertension could be the cause of constant chronic headaches related to Lyme and Bartonella? We are trying ashwagandha and glutathione. Any other suggestions? Intracranial hypertension could give you those headaches. I haven't actually seen intracranial hypertension as part of my treatment, so I can't say for sure whether it's being caused by the Lyme. I know minocycline sometimes can give increased intracranial pressure. And so you relook at the antibiotics that you're using, okay? I don't really have any other suggestions, though, unfortunately. All right. Good luck to you, Ginger. Hello, Mary. I don't know if I see your whole question here, actually. I think we're missing part. Mary, I'm sorry, I didn't see a first part to your question to be able to answer your question. I'm not sure what the whole question is here. All right, thank you. Hello, Barbara. Hi, Dr. Ross. My daughter, 14 years old, had a tick bite in July. The tick tested negative. However, she tested positive for a Western blot. She has been on Doxy and pulsed Tindamax since, I think you mean Tindamax, since August 1st, and on knotweed and astragalus and cat's claw. She has intermittent fatigue and headaches. Can I stop further progression? All right, let me make a few comments here. So first of all, tick testing is not perfect. It can often miss Lyme, even when Lyme is there. So I don't rely on tick testing. I rely more on symptoms, and also if there's a risk, if somebody's got a tick bite, especially if they've got a tick bite out east, for instance, out in New Jersey where 95% of ticks carry Lyme, I'm going to put them on antibiotics. All right. Okay. So my thoughts would be here. I know that they're pulsing the antibiotics. And one comment I would make is if your daughter isn't getting better on a pulsed regimen, I'd stop pulsing. I'd start using it continuously, especially the doxycycline. I would probably use that continuously. The Tindamax, I usually will pulse as a 4-day on, a 3-day off. The reason I pulse mainly isn't necessarily that it works any better to pulse, but I'm using it to spare the liver, okay? All right, now, if your daughter is not getting better, I would start wanting to know, is she having problems with co-infections? Are there some co-infections that got missed? So one of the number one reasons that people don't recover is there's a co-infection that's hanging out there, making it hard to treat, okay? So I would look and see, does she have a lot of symptoms of either Babesia or Bartonella? There's articles I've written about how do you diagnose and what are those symptoms of Babesia and Bartonella, but I'll talk about them briefly. So symptoms of Babesia can be drenching night sweats, severe fatigue, anxiety attacks, heart skipping or racing, a lot of temperature variation, so being hot 1 minute, cold the next minute, or temperature instability, I should say. Having headaches, a lot of headaches in the front of the head. Can sometimes, you mentioned she's having headaches, especially in the front of the head, can be part of Babesia. And then people with Babesia often will have frequent deja vu experiences, okay? Not all the time, but sometimes they can. So you want to see if she has a number of those symptoms, especially frontal headaches and severe fatigue, not getting better, I might start thinking about treating for Babesia. That could be holding her back, okay? Look and see if she has Bartonella. And symptoms of Bartonella can be pain on the balls of the feet, severe cognitive dysfunction, relatively worse than your energy dysfunction, okay? So the cognitive thinking being a lot worse relatively than what the energy is, okay? That often can indicate Bartonella. Bartonella also is known for giving psychiatric issues like ongoing anxiety or depression. Rage attacks can sometimes be part of Bartonella, or big mood swings, behavioral swings as well too. Bartonella is known for neurologic issues like numbness, tingling, burning. Bartonella is known for giving restless legs, which people have a feeling of things crawling on their legs, so they have to move them around a lot. Bartonella can give you a rash that looks like scratch marks or stretch marks in areas where you shouldn't have stretch marks, okay? Bartonella is known for giving you neurologic hypersensitivities like light sensitivity, sound sensitivity, touch sensitivity. All right, so I don't often test for the co-infections because the testing's unreliable. So even if they have done co-infection testing with your daughter and came back negative, that does not exclude having either the Bartonella or the Babesia. And the reason I don't rely on those is for Bartonella, we estimate 15 to 20 strains. We can only test well for 2. I'm sorry, that's for Babesia, we can only test well for 2. For Bartonella, we estimate 30 strains. There's about 28 animal strains, actually, that we think some of those get into humans from the tick bite. And we're only good at testing for 2. Those are the human strains. So you can still have Bartonella, or you can still have Babesia and have negative testing, okay? The other 2 big co-infections, one is called anaplasma, the other one's called Ehrlichia. If your daughter has been on doxycycline for at least 2 weeks, those should have been handled, okay? All right. Finally, if your daughter's not getting better, make sure she hasn't developed too many yeast in her intestines. That's because being on antibiotics can lead to too many yeast forming in the intestines. And if you get too many yeast in the intestines, those yeast trigger excess cytokines to be made by the immune system, okay? Secondly, those And those cytokines are what give you most of your Lyme symptoms, actually. And yeast release neurotoxins too, okay? So it can make your whole neurologic picture worse, all right? So those are some thoughts I have for you. Probably the best way I could help you would be to have a direct conversation, because there's a lot of questions I actually have to help you look at this further. And so what you might want to consider doing, I'd be glad to do this with you, is to look at doing a visit with me online. And so let me just do a quick screen share here too, and I'll show you how you could look into that and set that up if that interests you, okay? So I do a screen share here. This tab right here called Online Consult. All right, so I run a consult service that I call the one-to-one medical consult service, and this is where I get to visit with you online. And so to learn about it, read all the way to the bottom of the screen here where there's even a disclaimer about it. Just be aware that if you do choose to do this, I'm going to write a medical visit note. And it is something, my impressions about what is happening, you can, it's also information for you. I cannot prescribe antibiotics in one of these visits because I haven't examined your daughter, for instance, nor can I order tests, but I can give you lots of good recommendations. I can ask a lot of questions to figure out what's going on too. So that may be something for you to consider as well too. Okay? All right. Barbara, good luck with your daughter, and take a look at some of those ideas that I was talking about, see if they actually apply to her situation too. Okay? All right. Thanks for that question. Good luck to her. Hello, Karen. Let's see. My daughter is 20 and been sick since she was 7. The last year, she has gotten increasingly sick despite antibiotics and Malarone. We have just started homeopathy, but her doctors are recommending hospitalization for mental health. Let me see if there is another part to that question. Karen, I don't see a second part to that question. Let me just make a comment here. So there are a number of things I look at that could be blocking a person's treatment. And probably rather than going through all of them, I'm just going to show you where you can look at this yourself and see if some of these ideas might be helpful, okay? One of the first things, though, is if you've been on Lyme disease treatment for a long time, there is a great chance you could have developed too many yeast in the intestines, okay? And too many yeast in the intestines can make it look like your Lyme is getting worse and can make everything look worse. And the reason is that when you have too many yeast in the intestines, they release a neurotoxin called gliotoxin, which can bring out a lot of the neurologic symptoms. Secondly, when you have too many yeast in your intestines, the immune system sees those yeast and reacts by making inflammatory cytokines. Now, Lyme symptoms, when you have Lyme symptoms, those are actually excess cytokine symptoms, okay? So cytokines are made by white blood cells whenever they see an infection, and they're good and they're bad. On the good side, they cause more white blood cells to be made. They draw them to where the infection is, and they help them work better. But in Lyme, because the immune system doesn't do a good job, it keeps trying harder and harder and eventually makes too many cytokines. And too many cytokines give you what we call Lyme symptoms, basically, okay? So sleep disturbances, pain, difficulty thinking, hormonal disturbances, those are all things that you're going to see that are due to too many cytokines, all right? If you get too many yeast in your intestines, it does the same thing. So especially when I see a picture where somebody's been treated, they got better at first and then worse, think yeast. Or if you've been treated for a long time and they're just not getting better, think yeast. You've got to screen to see if you might have too many yeast, okay? There's other ideas I have for you as well, but let me just do a quick screen share here to show you where you can get this information. Here I have called Can't Get Better, Do This. Okay, and so read through here. I talk about the various things I'm going to start looking at when somebody's not getting well, all right? And so I talk about things you can do to remove biofilms. They can block treatment. You want to make sure that you don't have a mold or Lyme toxin illness. I talk about that here. I talk about even doing a trial pulsing antibiotics just to see if it makes difference. I want to see if somebody might have problems with their energy factories called mitochondria. I look, do they have chronic virus infections? I might consider changing their diet. I'm going to want to know, do they have too many babesia? Do they have babesia? Do they have yeast? Anyhow, take a look at this. I've got a bunch of steps and things that you might want to consider if you're not getting better, okay? But the big one among these is yeast, 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 and yeast. You want to consider, is there yeast there? And then one other thing about yeast that I'll take a look at here with you is you want to try to figure out if she has yeast, okay? And to help you look at that, take a look at my article called A Silent Problem, Do You Have Yeast? Okay, those are some things to think about. Yeah, anyhow, I hope that gives you some insight. Eventually to this chapter on steps to take, I'm going to have a piece about how to treat Persister Lyme too. Again, probably in the next month or two, you'll see that article coming out as well. All right? All right. Karen, good luck to you. Thank you for that question too. Good luck to your daughter. Hello, Andy. Let's see. My initial Western blot showed just an IgG band 41. After a 3-week challenge with Doxy, my retest showed just an IgM band 41. It doesn't look like Lyme, but do you have any ideas for interpreting this? My MD consulted infectious disease doctor said not to worry about it. Thanks. Okay. So in terms of Western blot, these bands that you're looking at are actually proteins that are found in the covering of the Lyme germ. And we're looking to see, has your immune system made antibodies against that protein? So there are a bunch of there is a protein that weighs 41 kilodaltons. That's the band 41, okay? In determining if somebody has Lyme, whether you're looking to see if you have antibodies attached to those proteins using the Western blot method, or you're looking to see if they have antibodies attached using that new SIRA-spot method that I mentioned earlier, you want to look to see, do they have antibodies against 2 of the following 6? And those 6 proteins are band 2325, band 31, 34, 39, 41, and 8393, okay? And whether it's the Western blot method or the new SIRA-spot method that I mentioned earlier that you're using to see if you have antibodies stuck there, we're looking at the same 6 proteins, okay? So you need to make sure that you're used a lab that will look at those proteins, all right? And using an FDA CDC-approved test kit through Quest, LabCorp, PAML, PacLab, any of the standard labs, they don't check for all those, all right? They just don't look to see if you have antibodies against enough of those proteins. So step 1, make sure that you actually used a lab that looks to see if you have antibodies against those 6 proteins. If you did not, go back and find a lab that does. And the lab that does is IGeneX. Another lab that does it is the SUNY Stony Brook Lyme lab will do that as well too, okay? All right. All right. Secondly, does it mean anything that a band 41 by itself is positive? Probably not. And here's why. The band 41 is a protein that is found on the tail of germs. Okay, so on the flagella of the spirochete, the end of the spirochete, the tail of the spirochete, form of Lyme, for instance. But any kind of bacteria that has ever had a spirochete in it, a tail on it, could result in antibodies being made against protein 41. By itself, it is just not specific enough for Lyme. All right. The fact that it came on after doing antibiotics, I'm not sure if that has any real meaning. It would have meaning to me if you happen to have gotten positive at one of the other proteins. I would have thought that that would mean something, but not in this kind of a situation. Okay? All right. Thanks for that question, Andy. Good luck to you. Hello, Kate. Let's see. Is it possible to have MARCoNS without a mold issue? Yes, it is. But I'm not a big believer in treating MARCoNS makes any difference. So MARCoNS is a condition that is described by Dr. Richie Shoemaker. Richie, as many of you know, is Dr. Shoemaker has been a pioneer in the area of mold toxicity, and then also something that he has coined called chronic inflammatory response syndrome, or CIRS. Okay, and so what Richie has been able to show is that about 25% of us are not able to remove mold toxins when we breathe them in, eat them in, or drink them in from the environment. And because they get trapped in us, they act as a source that flares up cytokines that make us really sick. So it can look just like Lyme, all right? But when somebody doesn't get better after removing those mold toxins, he starts wondering if there might be chronic inflammation that got set up as part of the process. But in looking at that, the next step that he says to look at causes of inflammation is to see if you might have infection from something called MARCoNS. And MARCoNS is a bacteria that can live up here in the nose. The MARCoNS stands for methicillin-resistant coagulase negative staph. Yes, it's a lot easier just to call it MARCoNS, okay? And so if he postulates, he thinks that if you have MARCoNS growing up here, that the immune system cannot get at it, and it sets up perpetual infection or inflammation, all right? Now, and maybe there's something to that. And he's recommended we culture, and he's recommended that we use various antibiotics and nose spray antibiotics and oral antibiotics. But the reality is you can't get rid of the stuff, all right? So I have treated it for years, and I have given up. And the problem is you can clear it periodically, and then it comes back. And I although it's showing up there, I am now becoming of the school of thought that it doesn't make a difference. Because even in periods where I have gotten it clear using nose sprays, antibiotic nose sprays, and antibiotic pills, I don't see people get much different or improve, nor do I see them get much worse when it apparently comes back on culture, okay? Now, I'm not alone in sharing this experience that you can't get rid of this stuff. I've talked to a number of my colleagues. We're just seeing you can't get this stuff out. And so, yeah, it may be there, but it begs the question, is it really a cause of anything? And yes, you could get it from just finding it there doesn't mean removing it is going to make a difference. And I don't think it does. All right. Just from working with it long enough, I just think it's not worth going after, actually. All right. Thanks for that question, Kate.